Health MEC Dr. Bandile Masuku is set to deliver his department's budget vote on Friday as the province grapples with the coronavirus pandemic. Gauteng is the second hardest hit province in South Africa with more than 14,000 cases. To find out how the fight against the virus is affecting the Gauteng Health Department's budget and focus, we're joined now by MEC Masuku. A very good morning to you. Thank you so much for joining us this morning. In your last address, you emphasized the department's priorities being centered around the NHI. And as we face COVID-19 and as the province becomes the second most affected in the country, where are you standing now with your plans and your focus around the National Health Insurance?
No, thank you and good morning to your viewers. One of the things that we have just undertook is just to take the COVID-19 pandemic, our response to actually be able to prepare for the National Health Insurance going forward. So in terms of facilities, in terms of staff, we are actually using the pandemic to catapult and fast-track some of the priorities that we had last year. So we are just going to be continuing with all the programs that we had, which dealt with mainly the issue of staff morale, the issue of patient experience in our facilities, which in the later on will actually contribute to the quality of healthcare and the introduction of the National Health Insurance.
And what are the main areas of focus going to be in your upcoming budget this year?
Most of the aspects will be dealing with building capacity in terms of infrastructure. As I've said, that we are using the pandemic, the response to the pandemic to fast-track some of them. So we will be dealing and reprioritizing the infrastructure development and building, and also the issue of hiring more staff, and also just stabilizing and consolidating management and leadership in our department.
As you speak about infrastructure, MEC, I know that there were 10 hospitals that you mentioned in your budget vote last year that needed urgent refurbishment, some of them including the Edenvale, the Dr. George Mukhari Hospital in Mamelodi and Tembisa. When it comes to your focus on ensuring that those problems are sorted out in those hospitals, I know that Tembisa is a critical hospital during the COVID-19 because you're relying on it to assist with the influx of patients. Where are you standing with rolling out and speeding up the processes around infrastructure?
Yeah, construction will be starting on four of the 10 hospitals that we had earmarked. You know, we spoke about George Mukhari. We are going to build 300 bedded wards around there so that we increase the capacity. We're also going to do the same at Kopanong Hospital in Edenvale. We're also going to do the same in Jubilee. So this is just one of the things that we thought we shouldn't stop we shouldn't stop our work and stop our program even if we are facing the pandemic. So some of the things we are fast-tracking or bringing them forward. So the program of the 10 hospitals is continuing. By the third year, we would have completed most of the things that we wanted to have done in those hospitals.
And how has the pandemic shifted your department's plans this year and the way that you plan to allocate funds? What are the big significant differences?
The big difference is that we're going to put a bigger portion of the budget on human resource capacity and also put more in terms of infrastructure, and also focus on issues relating to staff morale. You know that with the pandemic itself, we are faced with a greater challenge of fear and anxiety. And we also need, because of the program we launched last year of the EVP, the Employee Value Proposition, we are going to fast-track and actually make sure that that program is actually implemented.
MEC, improving staff morale is one element that you've continued to emphasize in your speeches and, of course, whenever you get the chance to. But now is a really important time to ensure that staff are indeed, inspired and receiving the psychological help that they may require during this really unprecedented time. When it comes to the employee value proposition project, what are some of the measures that you've put in place in that project or within outside the project to ensure that staff are indeed well balanced as they face thousands of patients on a day-to-day basis?
Yeah, I think the major issue is that with the pandemic, we have to deal with just allaying fears and anxiety, and just supplying them with enough PPE and protecting them, and also giving enough psychological support. That's one of the things that we are doing, and the employee value proposition program will take shape. It's work in progress. Will improve as it goes, but it will take shape as the circumstances determine. At the current moment, we are working on programs and interventions that are dealing with the pandemic, which are aiming at improving staff morale in that regard.
When it comes to some of your challenges, what are the key areas where you believe the department needs to urgently intervene and where you can make the most difference?
Yes, like I said, I think the most important aspect will be the EVP, and most of the interventions and things that actually require, particularly the equipment and the personal protective equipment, is a particular interest and of priority in the current rate. And it's something that we are going to be doing, and also employing more staff to make sure that there's no fatigue, there's no burnout, and our staff are actually working within proper working hours.
Thank you so much.